My name's Dr. Manrina Rhode, and I wanted to talk to you about dental imaging software. So imaging software that we use to create a mock-up for our patients, to show them the treatment that we're planning on doing, and to help us to be able to communicate better with our patients, and with the desired result, make sure we're all on the same page. There's so many different softwares out there, and they all do different things for us. So I'm old school. I'm a big believer in using Photoshop. I use Photoshop a lot with my patients to show them their different cosmetic options with treatment. I'll use it, I would say, 99% of the time when I'm about to contour teeth. So if I'm going to remove enamel from a tooth to change the shape of it, to improve the overall flow of a smile, maybe reduce some pointy canines or the length of the centrals, or straighten up the incisal edge of a lateral, then I'll jump on Photoshop and I'll very quickly show the patient what that would look like. I find I don't want to be that dentist that the patient, patients always have these stories about, I went to a dentist and he or she shortened my tooth and now my tooth's too short. I want to make sure that we've got a really clear, informed consent, and you can get a really accurate representation of what that result would look like. And also sometimes it helps with my treatment planning, because I'll start by contouring a certain tooth and be like, oh, actually it looked quite nice to do this one as well. So I use Photoshop. I know Photoshop is a bit of an arduous software to learn, but actually once you know the basic steps, it's really useful in dentistry. And I'm creating a course on my online course platform on Photoshop for dentists. So if it's something that you're interested in learning about, then jump on my website, drmr.co.uk, and look at the courses section and sign up there for interest in hearing about upcoming courses. And we'll make sure you're the first to know when that comes out. There's also so many other software softwares on the market. I also have IvoSmile in clinic that's made by Ivoclar, and it's a great software for showing patients their teeth whitened, and they can see it in a video, see what they look like with a whiter smile. And because you can control the whitening result, you could kind of show them where you think that they might whiten to. It also gives you an option to show them veneers in their mouth. You could use it for veneers and bonding, and rather than just a one size fits all, you can change the size and the shape of the teeth, choose the style of veneer that you like, change the incisal arch, change the size of the teeth. I think it's about $79.99 for the year. It's quite a useful app to have to quickly be able to communicate with patients. We also have the Airbrush app in clinic. I think that's about £40 a year. And there, it's not always super accurate because it's not designed for dentists. It's designed for a multitude of other things. We only use it for dentistry though. And it does the same thing, not with video, but with photo. And, I'll have it on our reception computer. I'll get our receptionist to upload the photos that we've taken of the patient and whiten their teeth and create, have a look what they look like with veneers or straight teeth on the app, and then send us the after copy. And if it's a nice result, then we share it with the patient to be like, oh, we've created this. And it's an immediate inspiration that can be really, really useful for the patient. I think we're in a really exciting time, obviously, with AI, where I'm sure very soon we'll be taking photos and uploading them into a software and just telling the software, make these teeth, show me what these teeth would look like at a BL3, show me what these teeth will look like with shorter incisors. But we're not quite there yet. So in the meantime, there's these various other software that we can use that I think are really beneficial in communication with patients and communicating with patients. I mean, with Photoshop, obviously, it allows you to work on their own smile, and again, it's really useful not only for contouring, but I also use it for gum lifts, so I can show them what their smile makeover would look like without the gum lift, but then add the gum lift in quite easily and say this is what it would look like with, and it shows the patient that benefit on their own smile, exactly what they would look like. I want to say exactly, and we shouldn't say that it's the exact result, but with a software like Photoshop, where you're doing it by hand, it's really quite accurate, where you can get their own smile too, if you're aware yourself where those changes can be done realistically without removing too much gum or bone or without removing too much tooth tissue. So yeah, exciting times, great software is available to us. That's where they might be useful, and exciting times to see what's coming next. And I'll be sure to update you as I learn more about new things as they come about.